An Emirati grandmother is 62 years old. She is always keen on staying at home. She abides by social distancing rules. She avoids shaking hands with her children. She cancels all her appointments in hospitals as a precautionary measure. All these she does are all because she avoids coronavirus. Nevertheless, she was infected with COVID-19. How? Well, one of her second-degree relatives kissed her on the forehead without taking into consideration her old age and weak immunity. A day later, it was found that the relative was suffering from COVID-19. As a result, the family members decided to take their grandmother for tests immediately. To her dismay, the result was positive. And the grandmother was quarantined without any companion to suffer from her pain alone. All the first-degree family members, who lived in the same house, were committed to the home quarantine rules since March in compliance with the government's orders. My grandmother, who was the most committed, cancelled her dental appointments and all other appointments that could be delayed and did not come out even for emergency reasons. She was very keen on staying at home and not touching any family member over the past few months, Maryam Hussain, the woman's granddaughter, said. But a second-degree family member visited my grandmother and kissed her on the forehead amidst the resentment of the other family members. After leaving, the relative sadly enough was found to be infected with COVID-19 and we had to take my grandmother to the nearest clinic for tests because she was the only one who got contact with him, she added. 2 days later, the tragic news came when my grandmother's result was positive. She was infected with the virus despite her keenness on not leaving the house. The virus came to her due to the carelessness of a family member, she said. The news was like a slap to us. It caused us fear and panic because my grandmother is old, her immunity is weak and she is suffering from chronic diseases such as diabetes and glands. We also made tests for all other family members but the result was negative, she added. My grandmother is now in quarantine and her condition is stable. I pray to Allah that she would recover soon because she is the blessing of the house, and the house will be gloomy without her, she said. Earlier, Sheikha Al-Mazmi, a role model for the Emirati nurses on humanitarian service, described her duties in a video message to the society during the coronavirus pandemic. The UAE Ministry of Health and Prevention, MOHAP, shared the video and said, Sheikha Al-Mazmi, a role model for the Emirati nurse in humanitarian duty. Her smile is a source of optimism and her work is a source of pride for her family, and is highly appreciated by the country's leadership and people. Thank you, our first line of defense heroes. Al-Mazmi works at Kuwait Hospital in Sharjah. Her mother said, I feel for her, but you know she helps others at the same time. On working away from home at a crucial time, Al-Mazmi said, this makes me worried about being far from family because I fear for them. Her mother said, I miss her and worry about her at the same time. I keep thinking of her and what she feels. I know she is strong. She is a real asset to her country. We are proud that our people are our first line of defense. Al-Mazmi said, all I think about is saving patients' lives. It is a matter of life and death. It is my time to help the nation. We all are one. It is the time to return the favor to my country. We, the medical personnel, are making a significant impact in history. Like Al-Mazmi, several young Emiratis have taken up the responsibility of serving the community. Recently, His Highness Sheikh Mohammed bin Rashid Al Maktoum, Vice President, Prime Minister and ruler of Dubai, praised a young Emirati girl Hamda Ali Al Dubi, who took up the responsibilities to become a nurse. Dr. Farida Al-Hosani, official spokesperson for the UAE health sector, called on the nation's youth to volunteer in all fields, and raise awareness about the novel coronavirus disease, COVID-19, based on scientific facts and credible information to counter misinformation and rumors often circulated on social media, which have been triggering needless fear and panic in people. Source: Gulf Today. Please subscribe to my channel. Thanks for watching.